We did heart failure. We're group 2, and I'm Jackie.
I'm Seamus.
I'm Jason.
Heart failure is typically a chronic disease that will progressively worsen over years. It's a condition where the heart cannot pump the amount of blood that the body requires. There are 3 ways that this can happen. The heart cannot fill with enough blood. The heart does not have enough force to pump the blood throughout the body, or some patients have both issues.
There are 3 types of heart failure. Left-sided heart failure is when the failure of the left ventricle to maintain a normal output of blood. The chamber does not empty entirely and therefore cannot accept the blood re-entering the heart from the pulmonary veins. The pulmonary veins then become swelled and fluid escapes through the vein and collects in the tissues in the lungs, leading to pulmonary edema and will eventually lead to the right ventricular failure too. There are 2 types of heart failure, systolic and diastolic. The drug interventions are different for each. Then we have right-sided heart failure. This is when the right side of the heart is not pumping blood to the lungs as it should. And thirdly, we have congestive heart failure. It is a condition where the heart cannot pump enough oxygen and nutrients to supporting organs, tissues. The decreased cardiac output is not enough to circulate the blood returning to the heart.
Okay, so if you just want to look at this graph here, it shows right-sided heart failure, left-sided heart failure, and congestive heart failure. 5.7 million adults in the United States have heart failure. More than 600,000 people die of heart disease each year. That is 1 out of every 4 deaths.
Signs and symptoms of heart failure: shortness of breath, chronic wheezing or coughing, edema, fatigue or lightheadedness, nausea or lack of appetite, confusion or impaired thinking, or a high heart rate.
These are the drug classes to treat heart failure. The first one is ACE inhibitors. These lower blood pressure and reduce the strain on the heart. The next one we have are angiotensin receptor blockers. These relax your blood vessels and lower blood pressure to decrease your heart's workload. The next are diuretics. These are known as the fluid pills. They help reduce fluid buildup in your lungs. And the last is cardiac glycosides. These make the heart stronger and pump more blood.
There's also beta blockers, which slow your heart rate and lower your blood pressure to decrease your heart's workload. Vasodilators relax your blood vessels so your heart doesn't work as hard to pump blood. Phosphodiesterase inhibitors block an enzyme in cardiac and smooth muscle. Blocking this enzyme increases the amount of calcium for myocardial contraction. Inhibition of this enzyme has a positive effect on inotropic action and vasodilation.
This slide does a good job depicting the differences between a normal heart and heart failure.
Lisinopril is an angiotensin converting enzyme inhibitor, so it decreases aldosterone secretions, therefore decreasing blood pressure and increasing cardiac output. It's an antihypertensive. The average dose is 10 milligrams a day by mouth. The half-life is 12 hours, and it's metabolized in the liver. Severe adverse effects of lisinopril are hyperkalemia and angioedema. Some common adverse effects that aren't as serious are cough, headache, dizziness, fatigue, pins and needles, orthostatic hypotension or dizziness upon standing, chest pain, diarrhea, nausea, nasal congestion, trouble breathing, and a dry, persistent, tickling, and non-productive cough. Some important drug interactions to consider are nonsteroidal anti-inflammatory drugs, insulin, oral antibiotics, lithium, and potassium-sparing diuretics.
Nursing.
It is important to consider that although ACE inhibitors reduce blood pressure across all races, blood pressure reduction is not as significant in those of African descent. they might need other drugs. ACE inhibitors increase the risk of angioedema, particularly in those of African descent. Anyone on ACE inhibitors should be monitored frequently for blood pressure, and their white blood cell count should also be monitored every 2 weeks for the first 3 months of therapy and periodically after the 3-month marker. Lisinopril is a pregnancy category D and should not be taken during pregnancy. It should be used cautiously in patients with renal impairment, and it is contraindicated in patients who are hypertensive to ACE inhibitors and in those with a history of angioedema related to previous ACE inhibitor use. Use cautiously in patients at risk for hyperkalemia and hypotension, and avoid taking potassium or potassium salt substitutes as it can increase the risk for hyperkalemia. Overdose can cause severe hypotension. It is crucial to educate patients to avoid salt substitutes containing potassium and foods with high levels of potassium and sodium. The patient should learn to slowly stand up to reduce orthostatic hypotension. Patients should avoid driving until they know how their body reacts to the medication, as it may cause dizziness, and the patient needs to immediately notify their provider if they experience any breathing problems, swelling of the face, eyes, lips, or tongue, as that could be a rare adverse reaction. A non-pharmacological measure which can be utilized in conjunction with pharmacologic treatments is exercise-based rehabilitation. A 2014 Cochrane review determined that heart failure patients who participated in exercise-based rehabilitation had less mortality rates, reduced overall and heart failure-specific hospitalizations, and increased their quality of life.
Lasix is a diuretic that is used to help remove excess amounts of fluid from the patient in a short period of time. When used by IV, the effects of Lasix are rapid, exhibiting decreased symptoms within 5 minutes of administration. The average dose is 40 milligrams by mouth 2 times a day. The half-life is 30 to 60 minutes and is metabolized primarily in the liver. The common adverse effects of Lasix are vertigo, headache, dizziness, pins and needles, weakness, restlessness, fever, vomiting, constipation, nocturia, polyuria, frequent urination, jaundice, muscle spasms, volume depletion and dehydration, and impaired glucose intolerance. Some severe adverse effects are leukopenia, ototoxicity, hypokalemia, hypovolemia, aplastic anemia, and pancreatitis.
Patients taking Lasix need to be monitored closely for dysrhythmias if they're taking digoxin or other cardiac glycosides. Use of potassium-depleting drugs such as corticosteroids or amphotericin B may cause hypokalemia. Using lithium concurrently can cause toxicity. It has also been known to decrease effects of insulin, causing hypoglycemia. Don't take Lasix if you're hypersensitive to the drug. You should not use it if you're in a hepatic coma or experiencing severe fluid or electrolyte depletion. It is important to monitor the patient closely for electrolyte depletion. Monitor patient for symptoms of severe urine retention due to bladder emptying disorders, prostate enlargement, or urethral narrowing. Monitor weight, blood pressure, and pulse routinely with long-term use. Before drug administration, check patient's serum potassium levels and withhold if potassium levels are low or indicate hypokalemia.
Teach patients to report ringing in the ears, abdominal pain, or sore throat immediately, as these symptoms could indicate toxicity. Alert patients not to store pills together to avoid drug errors. And advise patients that dizziness may occur. Instruct patients to rise slowly, limit alcohol, and avoid exercising in hot weather. Digoxin is a cardiac glycoside that works by providing a positive ionotropic action to increase the contractility or strengthening myocardial contraction by inhibiting sodium, potassium, and ATPase. The increase in contractility increases cardiac output, thus relieving heart failure symptoms and improving exercise tolerance. It also suppresses the SA node and slows electrical conduction through the AV node, which can help with dysrhythmias. The half-life is 36 to 48 hours and is excreted predominantly unchanged by the kidneys. Common adverse effects are anorexia, nausea and vomiting, diarrhea, agitation, fatigue, muscle weakness, hallucinations, dizziness, headache, malaise, stupor, vertigo, blurred vision, yellow and green tinge, and halos and light flashes. A severe adverse effect are arrhythmias and heart block. Patients with symptoms such as AV block or ventricular dysrhythmias that are not associated with heart failure should not use digoxin. Elderly patients should be closely monitored as they have increased risk of adverse effects. Patients that have renal impairment should be monitored closely as well, as this drug is excreted through the kidneys. And we should take caution when administering to patients with myocardial infarction. Interactions to avoid are use of diuretics concurrently with digoxin. This can cause hypokalemia and increase the risk of dysrhythmias. The use of ACE inhibitors are not recommended as they reduce the effectiveness of digoxin. Some nursing considerations for digoxin is to take the apical pulse before administration. Also, to monitor the serum digoxin levels closely, as the therapeutic range is small. Monitor potassium levels closely due to the risk of hypokalemia, and monitor elderly and pediatric patients closely, as these populations have a decreased amount of renal and hepatic metabolic enzymes. Some patient education would be to teach the patient about the adverse effects that may come from digoxin. These can include nausea, vomiting, diarrhea, appetite loss, and visual disturbances. We should also advise the patient to eat the same amount of potassium-rich foods each day, as well as to teach the patient how to take their own pulse so they can report changes in rhythm and rate. Metoprolol is a beta blocker that works by decreasing cardiac workload by decreasing the sympathetic stimulation of the heart. It reduces the progression of heart failure and the long-term consequences of the disease. In addition to heart failure, it can treat angina, hypertension, and reduce cardiac complications from myocardial infarction. Its half-life is 3 to 4 hours. It's metabolized hepatically. Some severe adverse effects are bradycardia, heart failure, and AV block. Some common adverse effects are fatigue, dizziness, depression, hypotension, edema, nausea, diarrhea, constipation, heartburn, wheezing, and rash. Metoprolol and the use of digoxin is not recommended as it could increase the risk for bradycardia. Additional caution should be taken in patients who are taking insulin or oral medications for treatment of hyperglycemia because it may increase the hypoglycemic medication effect. If there's an overdose of metoprolol, atropine should be administered. Some contraindications are patients with asthma are in cardiogenic shock, sinus bradycardia, hypotension, bronchospasms, cardiac failure, cardiac arrest, coma, or have an AV block, or experiencing nausea and vomiting. Some nursing considerations are to measure the apical pulse to ensure it's over 60 beats per minute before administration. When stopping the drug, taper off dosage over 1 to 2 weeks to avoid risk for angina or myocardial infarction. Closely monitor diabetic patients when using metoprolol, as it can hide the signs and symptoms of hyperglycemia. Monitor blood pressure frequently, as this may only present symptom shock. Reduced doses should be administered to elderly patients to decrease risk of falling and dizziness. Administration to children under 6 should not be permitted due to unknown safety and effectiveness, and this is a pregnancy C category. Some patient education for metoprolol is to teach the patient to report adverse effects and to not discontinue abruptly. The drug must be discontinued gradually over a couple of weeks under the supervision of the provider. Alert the patient to report any signs of shortness of breath. Advise the patient to avoid tasks requiring alertness, such as driving, until the effects of the drug are established. Instruct the patient to inform his or her dentist about using metoprolol because they may perform procedures or surgery.
Nasiratide is a vasodilator that relaxes smooth muscle and dilates veins and arteries to reduce systemic arterial pressure. The half-life is 18 minutes and it is metabolized in the kidneys. Severe effects include bradycardia, ventricular tachycardia, and apnea. Some common adverse effects include anxiety, confusion, fever, insomnia, pins and needles, angina, atrial fibrillation, abdominal pain, and GI disturbances. ACE inhibitors can increase hypotensive symptoms, so monitor blood pressure frequently if taking both. Nasiritide should not be used in patients in cardiogenic shock, and hold if systolic blood pressure is below 90 millimeters of mercury. Do not use if the patient has restrictive or obstructive cardiomyopathy. An overdose of nasiritide can cause excessive hypotension. Nursing considerations include monitoring the patient's blood pressure. It's crucial if taken with an ACE inhibitor. Do not give via central heparin-coated catheter, as the drug actively binds to heparin, resulting in a reduced amount given to the body and decreasing effectiveness. Avoid administering at higher than recommended dosages, as it can lead to hypotension and increased creatine levels. It is important to teach patients to report IV site discomfort, dizziness, blurred vision, and sweating.
Primacor is a phosphodiesterase inhibitor that is used in short-term treatment of heart failure by increasing the force of the myocardial contraction and the overall cardiac output. It has an immediate response compared to the other medications in its class, and has a shorter half-life and fewer side effects. The half-life on average is 2.5 to 3.75 hours and is predominantly metabolized in the kidneys. Some common adverse effects are headaches, ventricular ectopic activity, nausea and vomiting, and hypotension. Some severe adverse effects are ventricular dysrhythmias, sustained ventricular tachycardia, and ventricular fibrillation.
Avoid taking disopyramide. Use with caution when taking digoxin, dobutamine, and other inotropic drugs. Hypotension can occur from overdose and should be treated with saline or a vasopressor. Patients with pre-existing dysrhythmias should be cautioned and monitored closely. Nurses should monitor electrolyte and fluid levels, blood pressure, heart rate, and renal function. Patients with atrial flutters or fibrillation should be given digoxin concurrently with milrinone. Patients should immediately report angina. Headaches can be treated with analgesics, and patients should report IV site discomfort, dizziness, blurred vision, and sweating.
Atacand, amongst other drugs in its class, work to inhibit angiotensin II by blocking the angiotensin II receptors. It belongs to the therapeutic class of antihypertensive. These receptors are located on the surface of the vascular smooth muscle and other tissue cells. This blocking causes inhibition of the vasoconstriction that is usually produced by angiotensin II. Their half-life is 9 hours and is metabolized predominantly in the liver. A severe adverse effect is angioedema. Some common adverse effects are dizziness, fatigue, headache, chest pain, peripheral edema, pharyngitis, rhinitis, sinusitis, abdominal pain, diarrhea, nausea, vomiting, back pain, coughing, and upper respiratory tract infections.
Patients should take lithium with caution, as it increases the risk of lithium toxicity. NSAIDs may decrease the action and reduce its antihypertensive abilities. Potassium-sparing diuretics and potassium supplements could cause hyperkalemia. Avoid salt substitutes that contain potassium because they could cause hyperkalemia.
Is that what it is?
Atacand is a pregnancy category D, and use cautiously with patients who have renal function impairment. If hypotension occurs, place the patient in a supine position and give an IV infusion of normal saline if needed. Maximal effect will not occur until 4 to 6 weeks after starting the drug. Educate patients to notify prescribers if they become pregnant. Inform mothers that they should avoid breastfeeding. The drug should be stored at room temperature and tightly sealed. Okay guys, here's our references. Thanks for your attention. I hope you had as much fun learning about heart failure as we did recording this presentation.